health, rural Ontario is falling behind. Many in rural and northern Ontario don't have access to the care that they need. Dr. Wayne Caldwell's Healthy Rural Communities Toolkit highlights 10 health parameters where rural Ontario is worse off. This evidence points to health inequity and health care inequity between rural and urban Ontario. The World Health Organization states, health equity is achieved when everyone can attain their full potential for health and well-being. A few of the persistent rural health challenges are unequal access to health and social services, a lack of comprehensive basket of services, distance from these services and lack of transportation, and lastly, difficulty recruiting and retaining healthcare professionals. Let's focus on this last one for a minute.
Our most significant operational challenge is staffing, followed by housing for staffing. So currently our solution is agency staff brought from the cities, the urban areas to our community. The long-term solution would be to hire more people to the community or provide some kind of opportunity for the spouses so that families can move to this area, because agency is not a long-term solution because it costs twice as much to support an agency staff as it does our own.
Across Ontario, the affordable housing crisis is very real. However, it is especially acute in rural Ontario, where very little rental housing exists. The Gateway Centre of Excellence in Rural Health is a not-for-profit based in Huron County, dedicated to improving the health and quality of life of rural residents through research, education, and communication. They have lots of different projects to help better understand and share ideas about issues affecting the rural health landscape. This past week, I had the opportunity to see one of their projects in action, the Rural to Rural Conference. This conference is organized by the Centre for Rural Creativity with support from the Gateway Centre and others. This past week, over 100 rural development practitioners from across rural Ontario gathered in Brussels, Ontario to talk about wellness, housing, climate, and community. Ontario's Gateway Centre of Excellence in Rural Health was inspired by a similar centre in rural Kentucky, founded by Dr. Beretta Casey. Lesson 1. Dream big. Create the vision. Identify where you want to go and stay laser focused on that outcome.
It simply was Googling Centre of Excellence in Rural Health, bottom line, and nothing came up in Canada. So I called down, Centre of Excellence in Rural Health, Hazard, Kentucky came up. So I called down and I got this really warm, hello, definitely Kentucky style welcome. And I said, do you think it's possible that we could come down and visit? So, I just see us getting stronger. I do argue with some of the people around me that we will be the Centre of Excellence in Rural Health for Canada.
Once you've identified the vision, build relationships and collaborations to make the vision happen. This involves active listening, asking a lot of questions to truly understand the different perspectives, as well as making connections, collaborating, and building momentum and support for your idea.
Making the community as involved as possible in like not only the planning, but also like the development of healthcare services to address the local concerns. Because I think when we do that, we then make a more sustainable healthcare service.
Lesson number 3, get the data. As someone said at the conference, change takes time, patience, and data. Not only does this support better evidence-based decisions, but it also helps secure funding.
We're fighting for our identity in rural and the importance of our rural stats. And once again, we've both spoken to the fact of lack of rural health stats. And if we had that to go on when we started, we had to really look hard. We know we have higher rates of diabetes, heart disease, as you were saying, some forms of cancer and obesity. We know we have higher rates than urban, but we don't have a lot of stats on it to prove ourselves.
You need that like market research. You need to be able to assess where are the gaps and like where things are like trending and going to be able to sustain those people to stay locally.
Lastly, adapt and repeat. Revisit the vision, experiment, collect data, share your story, build support, get more funding, and the cycle continues. It's a continuous iterative process.
My concern is we are still not developing enough healthcare providers who are from rural areas, who understand rural people.
Rural health inequity is truly a complex, wicked problem. Recruiting and retaining healthcare professionals is just one aspect, and if we're going to tackle it, we need to create a compelling vision, connect and collaborate with willing partners, try things, collect meaningful data, share our stories, and continuously adapt what we're doing to meet the needs of our rural communities.